We're live. Good evening, everybody, and thank you once again for coming back and joining me on my YouTube series. For the last 2 weeks, we have been discussing maternal mortality, particularly for women of color, and in more particularly for Black women, that the rate of deaths for Black women in the United States is more than twice that of white women. My goal has been to be able to provide information to empower women and their families to learn more about themselves, understand their own risk factors, understand the health system so that they can make informed decisions about what they want to have happen to them during their pregnancy and during their birth process. I'm so happy to have with me tonight Ms. Marsha Ford. Marsha Ford is a certified nurse midwife who has been practicing in Georgia for more than 30 years. She is the first African-American midwife to own a private practice in Atlanta, Georgia. She was the owner of OBGYN and Midwife Associates, which was a family-centered midwifery care practice which provided women's health and, of course, prenatal, labor and delivery and postpartum care. She assisted mothers with their births in the hospital, and she'll tell us more about that until that hospital was closed. Now, after the closure of that hospital and with Marsha's practice, there are now no other independent midwife practices that do hospital births. Marsha is now the owner of Home Birth Midwifery Care Incorporated in Atlanta, Georgia, where she is now doing home births. Marsha's work was mainly in the projects of Atlanta, Georgia, in the Bowen Homes of East Lake Meadows community and the Herndon Homes community. Marsha is a graduate of Tuskegee Institute, where she received her bachelor's in nursing in 1982. In 1993, Marsha received her certificate in nurse midwifery from Charles Drew University in Los Angeles, California. Marsha is the recipient of numerous awards, including the Armentia Jarrett Award and other awards from Georgia for being a trailblazer in her community. There's been a change in legislation in Georgia that now has tightened down on midwives, where you can only enter and deliver babies in hospitals if you have a sponsoring physician or you are an employee of a physician or a corporation. In September, Marsha will be traveling to Zanzibar to do training of birth workers there. So we will hear more about this a little bit later. But Marsha, thank you so much for agreeing to participate in this session tonight. The goal is to be able to really introduce many health providers to our audience. So thank you.
Thank you for having me. Thank you.
Yes. So Marsha, it would be great to hear a little bit about your practice, about the type of women that you served, how you worked with physicians. I'd love to hear more. Our audience would love to hear more about that.
My practice started in the south side of Atlanta, an underserved community. When I first went there in 1993, I worked for a federally qualified health facility for 5 years. And that's when I was in Bowen Homes, Herndon Homes, East Lake Meadows. And then when I changed out of there for their change of, change of administration, I opened up a practice because I did not want to leave my community. So I reached out to some physicians and everything about opening up my practice. So for 24 years, I've been on the south side in East Point, Georgia. I was there, love every minute of it. Delivered at 2 hospitals. South Fulton Hospital was right next to my office. Could go across the parking lot. They closed that hospital first. And then I was sent down to downtown Atlanta Medical Center Hospital for 12 years. And now they closed that in, I think, October, November of 2022. So now as we were said, that my midwifery practice, I could not go back in there unless I was an employee of a physician. And I felt at that time that I would not be able to do midwifery. I would have to do what we call midwifery, a lot of medical, trying to deliver a baby medically, under physician at that time. And so I chose not to do that. And I still want to deliver some babies, but at a slower pace. We were doing over 20 something babies a month because I was specializing in water births.
Yeah.
And Medicaid patients were not being taken for water births in Atlanta. You would have to go out an hour away to go to another hospital to have that specialty done. So that's what I was doing. So people were coming for that. And we were doing vaginal birth after cesarean in water. And we were doing a lot of VBACs, as we call them, and at the hospital. That hospital, I want to give kudos to Atlanta Medical Center. They let us do a lot there. And I always told patients, I will try to give you a home birth delivery in a hospital. That means you got water births, you got to walk, eat light, you had candles, you had music. I had, daddies playing guitars. We had a lot. And we're going to send some YouTube out to you so you can see what was done. But now it is no more in Atlanta. So legislation has changed that. Well, hospitals has changed it, because if the hospitals will allow us to come in, we could come back and do that. But that's not allowed at this time.
Yeah. So in the United States, unlike other developed countries, midwives are not embraced as much as they are in more industrialized countries.
Sure.
And so I think this is why we're seeing the maternal mortality rate the way we are. We don't see that in those countries where midwives are front and center. They're your first line of defense, as we would say, for pretty much low risk births. So you were telling us about some of the really nice birth experiences that you had in the hospital. Can you talk about the risk factors of the women that you saw? What types of women were you able to see, and which ones did you decide you needed to really have a physician take care of? Can you give us a little more information about that?
Okay, we have to, midwives, certified nurse midwives, have to have a collaboration physician. And it was my sponsoring physician. I have to send out kudos to Dr. Lorenzo Simmons, because he really allowed me to do midwifery. And some of the patients, they, like someone that was 300 pounds or 350, they need to see physicians. Someone that was twin births, they needed to see a physician, because I didn't have a physician in my office. With a certified nurse midwife, we do not have to have a physician in the office with us seeing patients. They had to have a referral base, and he was that referral base. Okay. So if somebody was chronic hypertension on multiple medications for high blood pressure, I referred it to the physician. Twins, as I state, and we one time had 4 twin sets come up in that office that year. They all got referred to physician. Now, anybody that was breech, because I don't do breech deliveries, so I sent it to the physician. A lot of cardiac disease, and we had some cardiac, that means heart. They had heart problems, or they had sickle cell disease, or they had any other influent like asthma, really bad asthmas. Mild asthma we were fine with, but someone that's on a lot of medication for asthma should be seeing a physician. Or someone in my practice had three or more C-sections before having a vaginal birth. They went to see a physician. Now, okay. 1 C-section and maybe 2, I did those in the hospital. Okay. And that was allowed. And some of them did it in the water.
So you're saying you did the vaginal birth after C-section, after the water. Yes. Okay. Okay.
In the hospital. Okay.
Yes.
So we trailblazed a lot of stuff at Atlanta Medical Center. Okay. And for midwives to be able to do. So you need that collaboration. You need that person that believes in you. And that physician believed in me. He believed that when it was time to transfer a patient, I would transfer. If I had a question, I could call him, I could talk to him and ask him, what did he think about this person? And we had that good collaboration. And I believe that is what is needed now to keep the maternity, the mortality and morbidity down. We have to be able to talk to each other and communicate with each other. And, you know, his medicine or my midwifery, we can work together with that. So women can get what they want and what they choose, you know, choices.
So listening to you, what you're saying is that women who are pretty much without those kinds of complications or risks. So if I don't have high blood pressure, if I don't have twins, if I don't have heart problems, then I can see a midwife. And even if I did, that it's possible that I could still see a midwife along with the doctor. That's what it sounds like you're saying. So there's a lot of space in which women could actually be cared for by midwives safely, still have access to the doctor when it's needed. And then when time comes, the midwife has identified, I can no longer take care of you. I need you to be seeing the doctor now.
And I'm going to send you to someone that I trust, that he will take care of you and respect you just like I respect you. And they accept that, I think, much easier than going to someone they've never, don't know anything about.
That is great. So can you talk us a little bit about, you talked about hospital. You now are beginning to do home births. And just as you talked about, there were points at which you needed to transfer to the doctor. What are the points that you have experienced with home birth where you may have needed? First of all, I think the first question too is, what do I need to have a baby at home? And then the other is, at what point have you ever had to transfer a baby or mom to the hospital? What was the reason for that?
We have oxygen we take, as well as medication for bleeding, medication for blood pressures. We use herbs as well. Certified nurse midwives can use medication. We have it. And we have that, the same about things that we have in the hospital. We have to have that same kind of skill set to transfer to the hospital, just like if we were in the hospital and I tell the nurse, I think you need to get the doctor in here. And the doctor needs to come over. The doctor needs to assess this patient now. It is the same set. And I can give you examples. Like if I have a baby, that we have pulse ox that we put on the baby's foot or finger and stuff to check their oxygen level. If it is low, it's below 90s or 93, and it won't stay, up, I'm going to say it's time to let this baby go to the hospital and get evaluated some more. Or mommy's having problems with bleeding. We have medication we can use, the same medication in the hospital, Pitocin, Cytotec, the same medication. And if it's not controlling her bleeding, she needs to go to the hospital. We have that already set up what hospital they're going to go to for emergencies, and what hospital they're going to go to if, let's say, mommy, as we call it, tap out. Say, I can't do this at home anymore. I want some help. I want some pain relief, because we cannot give pain medicine at home.
Yes.
That needs to be monitored. The baby will have to be monitored and mommy monitored. So if she needs that, she needs to be transferred to the hospital. So that's what we do. Okay. So you have those extra steps in place. That's for baby, and that's hemorrhaging or bleeding or high blood pressure, and that's for mommy, or she start having any problems with her breathing. We have oxygen there. Yes, we do. But if she's going to be having those kind of issues, she needs to go to the hospital. And we have that set in place, what hospital to go to, how far the hospital is from the house, and everything, and how to get in touch with EMS, that's the emergency system, to come and pick her up. Or if it's not really detrimental at the time, then the family member can take the person to the hospital.
Yes. Okay. And then also, who else is helping you at home with the birth? Is there any other person
Yes.
out there besides you?
You have a birth worker that's been trained to help assist you with births. Just like you have in the hospital, you have nurses there. We have birth workers there. She may not be a nurse. She's somebody that's been trained to help you with that birth. Or you may have another midwife there with you. If that's whatever choice that you've made, because you always need one person for mommy and one person for baby. Because what happens if two goes out at the same time? You're only one person. So you need to have, someone else there with you, and sometimes you'll have a midwife and a birth worker. With my things that I do, I want the patient to have a doula as well. That person to support the mommy while I'm doing what I'm supposed to do as a midwife. The doula is doing her part. The birth worker is helping me at the time. So we have a village. I always say you need a village to deliver this baby. And daddy is right there in the midst of everything. And he's listening and he's doing what the midwife has asked him to do. And you have a village. And it don't just has to be daddies, whoever that village person is for you. Women should not deliver alone. They should have a village. That's what I believe. They should not deliver alone.
Marsha, you have many years of experience, and there's now the plan for you to go to Zanzibar to do training with birth workers there. Can you tell us a little bit more about that? We'd love to hear more about that.
I was selected to go, and it's an honor. I've never been in another country to educate in midwifery. That I've always wanted to do it, but I couldn't go because I had this practice that needed to be covered all the time. So this is my time. Since now I am free from that practice and that door has been closed, God has opened another door for me to do this.
Okay.
And we're to educate at this Wajimama in Zanzibar. It is a women's health center, birth center. And then we will stop over in Kenya to another birth center. The only problem I have at this time is funding, because now I cannot fund myself. So that will come out, a GoFundMe to help me get over there. When I even do what some women don't do, circumcisions. I do that also. I've been trained to do that for over 20 something years. So I do all the circumcisions mostly for my patients that I did. And it is good to know that when mommies come back and have another baby or deliver somewhere else and say, you're the only one going to circ my baby because my baby did very well. It's a privilege. And I want to teach them that. And they are going to allow me to teach them circumcisions, childbirth education, prenatal care, everything over there. We're going to have doulas that go on, birth workers that's going, and other midwives. So I'm just hoping and praying that God has that door open for me to go to do this. And then hopefully I can expand out to other countries. I want to teach families that is when we have a birth, we are trying to build families. We're not just birthing a baby and a mommy, we building families. So they need to be working together as a village to bring these families together.
Marsha, thank you so much. And thank you so much for giving us your time this evening. The information you've given, I'm sure, will really enlighten families and individuals who are looking at this. We will put your information in the description in regard to other YouTube videos that are available for the types of births that you were doing, as well as a link to your GoFundMe account for anyone who might be interested in helping Marsha to go. Zanzibar's maternal mortality rate in the United States for overall, it's 32.2. For Black women, it's 69.9. In Zanzibar, it's 424. So that's 8 times the amount that it is for Black women. The other thing to keep in mind, too, is for Black women, the age of 40 and over, it is 300. We are looking like third world countries in the United States when it comes to maternal mortality. So Marsha, thank you so much for your time.
Thank you.
Tomorrow night, we plan to have another midwife on who will be from Virginia. It's to be able to help the audience know that there are midwives of color. A lot of times as patients, we want to see our own people. We also know that in the healthcare system, it's not a possibility. It is a proven fact that there is racism in the health system. There's structural racism that came out when I talked about the Maternal Mortality Review Committee here in Washington, D.C. They identified structural racism as the reason for maternal deaths in Washington, D.C. We talked last night briefly about the Johnsons who went in for cesarean section and his wife died. And it was found to be racism, and they are now being investigated by the federal government. So our goal is to discuss this topic and to also bring forth providers of color so that people in the audience can see we exist, we do exist. So Marsha, thank you so much. Have a great evening.
You too. Thank you for inviting me.
Yes, thank you.
This is my first podcast, y'all, and I'm telling you, I was nervous.
Oh, she did a great job. Did a great job.
I hope I answered your questions. I hope.
Thank you, Marsha. Thank you.
Thank you. Have a good evening.
Yes.
Bye-bye.
Bye-bye.